Welcome to Week 5 of the NCLEX Success Track Physiological Integrity Part 1 Basic Care and Pharmacology. In this section, we focus on the nurse's role in maintaining a patient's physical health through safe, evidence-based care. You will review essential principles of daily care, comfort, and medication administration, all key areas tested on the NCLEX. The physiological integrity domain includes 4 subcategories, but in this week we will study only the first 2. Basic care and comfort, and pharmacological and parenteral therapies. These areas measure how well a nurse can support physical well-being, prevent complications, and deliver medications safely. Promoting independence in activities of daily living, bathing, dressing, feeding, toileting, and ambulation is essential to patient recovery. Nurses should reposition immobile patients every 2 hours, perform range of motion exercises, and monitor for signs of deep vein thrombosis or atelectasis. Maintaining mobility prevents pressure injuries, respiratory issues, and loss of muscle strength. AFE feeding techniques are vital for clients with swallowing difficulty. Always position the patient upright at least 30 to 45 degrees, provide small bites, and use thickened liquids if ordered. When administering tube feedings, verify placement, check the residual volume, and keep the head of the bed elevated to prevent aspiration. Remember, nutrition equals safety and energy for healing. Assess pain regularly using a standardized pain scale and always reassess 30 to 60 minutes after administering medication. To promote elimination, encourage hydration, dietary fiber, and mobility. Constipation is a common complication in immobile or postoperative patients, and early prevention greatly improves comfort. Rest is a key component of recovery. Encourage patients to maintain a consistent sleep schedule, limit noise and light, and avoid caffeine or screen exposure before bedtime. Quality sleep enhances immune function and tissue repair, essential for physiological stability. Inspect the skin daily, paying special attention to bony prominences such as the heels, elbows, and sacrum. Use pressure relief devices and reposition every 2 hours. If redness or breakdown is noted, intervene immediately to prevent pressure ulcers. Healthy skin reflects overall physiological integrity. Medication administration is one of the most heavily tested NCLEX areas. Always follow the 5 rights: right patient, right drug, right dose, right route, and right time. Verify allergies and use 2 identifiers before each administration. Remember, safety before speed, never given in labeled or unclear medication. When caring for IV sites, observe for infiltration, phlebitis, or infection. If infiltration occurs, stop the infusion immediately, elevate the limb, and apply a warm compress. Maintain clean technique and change tubing and dressings per policy. Continuous vigilance prevents serious complications like extravasation or bloodstream infection. All parenteral therapies require sterile technique. Before mixing or administering medications, verify compatibility, especially with IV antibiotics or electrolytes. Administer injections at the correct angle and rotate sites to prevent tissue injury. Accurate, aseptic technique protects both the patient and the nurse. In this first half of physiological integrity, you learned how fundamental care, comfort, and medication safety maintain the body's stability and prevent complications. These skills represent the foundation of nursing. Every action, from turning a patient to giving IV medication, contributes directly to physiological integrity. Next time, in Part 2, we'll explore risk reduction and physiological adaptation.